A study just published in the Journal of the American Medical Association shows that although suicide attempts have risen significantly over the past 11 years, the number of people who receive mental health services after a recent attempt has remained somewhat stagnant at 60%. For more now, we're joined live on the KCBS Ring Central Newsline by Leigh Richardson, founder and clinical director of the Brain Performance Center. Leigh, thanks for joining us this morning.
Thanks for having me.
So, Leigh, which groups show the largest increase in suicide attempts?
Well, the age from 10 to 35, suicide is the second leading cause of death. And that is such I feel that in my heart when I say those words. And I think it's because, and the study, this is what's amazing to me, the study that we're talking about does not look at anything after the pandemic started. And we all know that isolation, loss of community, all of those things certainly factor into a decision around suicide. So I wonder what the numbers will look like for 20, 21, and 22.
Yeah. Leigh, what are the main barriers to accessing mental health care? I mean, how do they affect people who are struggling, particularly with thoughts of suicide?
Well, I think the main barriers is the stigma that's associated with needing mental health help. And sometimes that stigma comes from within. Shame on you, Leigh. You don't need any help. You just need to power through it. And then sometimes there's the stigma that society puts out there. If something's wrong with you, you just need to work through it. And this is what I don't understand. If you hurt your leg, what do?
Yeah,
you go to
to
a
the doctor, sure.
If you wake up and you ask yourself, I don't know if I'm going to be able to get through the day. You have that nasty conversation with yourself. Come on, just shut up, suck it up, buttercup, you can do it. That we need to shift that dialogue. It's okay to not be okay. And I think that is what holds people back from getting mental health. They don't want people to know, other people to know they need mental health. And they maybe feel like they're somewhat discriminated against in the workplace because they need it. And certainly the level of insurance is different around what we provide for physical health than it is in a lot of companies what we provide on mental health. And sometimes I think it's honestly, they just don't have the money.
Yeah. It's really amazing to me to think, with this study in particular, you have someone that actually tries to commit suicide, a recent attempt, and then only 60% of people receiving some sort of mental health services after that. I mean, it seems like it would be something that would be, required, say, if you're in the hospital before you're discharged or something like that, that you'd be required to see a mental health provider or something before you left. I mean, that number seems really low to me, 60% after a recent attempt.
Well, I agree with what you're saying, and it's almost like we need some type of systemic follow-up and a process. And when if you go to the ER with a suicide attempt, they need to have you talk with a counselor or a social worker before you leave the hospital and just say, what's your support system? Because a lot of time, the suicide people that are experiencing the desire for suicide, they don't have a support system. They don't have anybody that they feel like they can turn to for help. And they feel like, it would just be easier if I wasn't here.
Leigh, as your work that you do with the Brain Performance Center, it seems to me like you said, someone breaks a leg, they go to the doctor, but the brain really is. Would you say it's accurate to say it's kind of like the unknown still, kind of the last piece in the healthcare field, in the world of medicine that we're still learning a great deal about, like by leaps and bounds, because it's still kind of the unknown.
Well, you're absolutely right. It's only in the last 10 to 15 years that neuroscience has really come into play. And the more we learn, the more we know we need to learn more. And everything you do, you don't do, how well you do it, it's all on how your brain is working. And my goal for 2022 is to shift instead of thinking mental health because people think that's bad, think brain health. The brain is an organ just like the heart.
That's
and
right.
if we can get people to think of the brain that way, I think that will reduce the stigma they have within themselves and will encourage them to get help when they need it.
Yeah, well said. Leigh, thanks so much for joining us this morning. That was Leigh Richardson. She's the founder and clinical director of the Brain Performance Center.